Well, good morning, everyone, and welcome to yet another edition of the Detroit Regional Chamber's Tele-Town Hall series. We're so pleased that you've chosen to spend your valuable time with us again today, and we hope, as always, everyone is staying healthy, doing well, and hope you're enjoying a little bit of sunshine on this nice, bright, sunny Michigan day. We're very pleased today to have a good friend of mine and a great public servant joining us on today's Tele-Town Hall series. The Honorable Mark Hackel, the County Executive for Macomb County, is with us. Mark, good morning. Welcome.
Good morning, Sandy. I appreciate that introduction. I have a brother who's a judge, and usually he's the one that's called the Honorable. So I guess I'm hoping he's watching. You get to hear that for the first time, with my name injected. So how you doing? Okay.
As an elected official, you always have that honorable marker, regardless how you might behave. You're honorable.
Yeah, I appreciate it. I appreciate it. Just trying to get the people's work done. That's all.
So first of all, and perhaps most importantly, Mark, how are you and Tracy? Health, you guys holding up good?
Yeah, extremely well. Doing great. Fortunate. She's been very healthy, and the rest of the family. So, no issues there whatsoever. Everybody taking the precautions necessary, but for the most part, just trying to, do what we need to do to get the day by, and still exercising. Even though my two favorite gyms are closed, I'm still getting out and about on the trails and trying to get a little bit of exercise as the weather permits.
Well, knowing you, Mark, it doesn't surprise me a bit that you're getting in a little bit of exercise. So that's great. And tell us, how's the county doing? Obviously, you had to shift to work from home a large part. So how's the county functioning? How are you guys doing during this crisis?
Yeah, I think if we kind of take a step back, and if you recall what happened, back in, whether it was the United States when it hit with this first case January 21st in Washington State, there was kind of a concern as to whether or not this was, a real issue. Was it a real pandemic? Was it a hoax? Then obviously March, 11th happens where we see two cases simultaneously, Wayne and Oakland County, and then 2 days later, Macomb County gets hit with their first case on March 13th. So when that happened, there were still people that really weren't buying into this. And immediately talking to our health professionals here at the county and listening to what was going on across the state and even the country, we come to realize there's a real pandemic and it's coming our way, and we're going to be impacted, quite significantly. And seeing what was happening out of Detroit, so immediately we started, making some decisions internally, much like you're seeing with yourself and your work environment. About 80% of our workforce, we were able to get into remote work locations, basically out of their homes. And so fortunately, to kind of decrease the number of people that were coming in contact with one another and trying to figure out, where is this headed? And, immediately it was about the PPEs. What are we doing about the surges in the hospitals? And so, led by the governor. And fortunately, she listened to some of those healthcare experts and said, you know what, we got to figure out how do we reduce the, if you will, the amount of exposure the hospitals are getting, and, lessen that curve and see if we can't minimize that. And a lot of people weighed in. And so here in Macomb County, all systems have been go this year. That location I'm at right now is not my home. It's been my home for the last month and a half. This is called the Comtech Center, Communications Technology Center here in Macomb County, which has every facet of what we do, from emergency management, road department, dispatching, police, fire, and EMS, as well as our IT services. This is our central hub. We've been working on this from day one to try to figure out how do we organize and provide, necessary information to the schools, the hospitals, the 27 municipalities that make up Macomb County. And we have been kind of that, if you will, central point of contact with everyone, trying to get them as best information as we can, update them, and try to help them through their challenges as well. So a lot of people in Macomb County, I think they all get it. They realize it is a pandemic, it is a crisis, it's a real issue, and they've been weighing in on it. Thus, the reason why I think we have lessened that curve. The hospitals have, told us they're open for business now, even doing some of the non-elective surgery. So, Macomb County, I tell you, credit to the folks here. They really stepped up, met the challenge, and again, I think they all understand that this is still a crisis. It's not something that has gone away.
So, Mark, the Macomb Daily News reported, I believe, yesterday or Monday, and you were quoted extensively, that the number of cases in Macomb County has taken a dramatic turn for the better. Talk to us about the trajectory. Kind of when did you have your spike? How long has it been declining in Macomb County?
Yeah, again, when you stop and you think about like the largest, impact we had, probably the biggest number we had was on April 14th. we had 236 cases at that time. You know, if you're looking at the number of deaths, any one day total, it was just kind of before that. It was April 12th where we had 32 deaths reported on a single day. Well, as we sit here today, we don't have the numbers from the 12th or the 13th, but May 11th is the last date we have with the facts of numbers. And as I mentioned, 236 was the highest number we've had. Today, May 11th happens to be, 26 people reported as being, contracting the virus, and only 2 deaths. And I say only 2 deaths, not to minimize that. Obviously, any death is something we're all concerned about, but significantly less than the high number of 32. So, it's dramatically decreasing, and I think it's because of people, trying to figure out how they social distance, wear the masks, and do what CDC recommendations are requiring of us.
So as the executive of one of Michigan's most populous counties, you have to make some decisions, and I know you're talking to the governor. You've been on a slightly different page than the governor in these last few days about kind of the path forward. Do you want to talk about where you and your friend, the governor, might disagree on how to approach stay at home?
Yeah, and you know what? I think you hit that just right. I mean, we are friends. We get along. But unfortunately, sometimes we're going to disagree. I mean, we all have done that, with some things. And it's not that I disagree about her stay-home order. I think she did the right thing immediately by making a determination what was essential, non-essential. I support that wholeheartedly, and it did, without question, lessen the impact on the hospitals, and that was the original goal. We got through that. So the question became, as we're starting to see that curve lessening and some of these businesses opening, we're getting inundated with other businesses saying, okay, when are we going to have a chance? And then when you come out with this kind of 6-point color-coded chart that was very complex. I mean, let's be honest. I still have to go through it to try to figure out how do I answer a question to a local business as to when I think we're going to be able to allow them to open based upon a governor's decision. And what most people don't realize is these aren't our edicts. These aren't things that are coming from the executive's office here in Macomb County. We are following CDC guidelines nationally, as well as whatever the governor decides to incorporate into an executive order and making it law. And so, my question is okay, what is it about the data? We're going to rely upon the data, the information. We all know what the data is, and it's pointing in the, I guess if you will, it's trending in the right direction. But what is it that a business owner is going to be able to say, whether it's a hair salon, whether it's a gym, and the like, when are they going to be able to open? Because that's the question we're getting, even restaurants. And so the thought is, there are a lot of people that have different levels of comfort and fear, and they're going to continue. This isn't going to change over the next month, year, probably a year and a half, maybe even 2 years. There are going to be people that are going to be very much uncomfortable going out and wanting to go places. Yet there are other people that have a very, limited amount of fear. So the question is, how do you balance that, make a determination? How do we trust our businesses that don't want to, put their employees in harm's way, don't want to put their patrons in harm's way? So, some are just saying, listen, we can prepare ourselves and put something together that we're comfortable with and get back to business, maybe not as normal, but progressively, so those that do feel comfortable venturing out and want to come to the hair salon, want to be able to go to, the gym, can do that in a very safe environment. How do they get to that point with not even knowing when that date is or what it is we're relying upon that's going to make that decision available to them? So they're ready to do that. Some may never open their doors. Some are going to be too, concerned about this, passing on to an employee or even a patron. So they're not going to want to. And I always say, it's not to discount people that have this level of fear. Nothing changes if and when we start allowing businesses and trust that they're going to put good practices in place to do that. Nothing changes the fact that people that maybe are elderly, people that have health issues, or people that just have a fear factor, don't want to go, then they still don't have to go. Or a business who doesn't feel like they want to open because of those very same reasons doesn't have to open. But my question isn't so much that I disagree with the stay-home order. It's when is it? And I can't get through the color-coded six-stage chart to understand how to, explain that to a business person. And so people kind of have fashioned this question and, kind of like the dialogue as being, I disagree with the governor and, her and I are getting along. And that's not the case. I couldn't agree with her more, what she did. I think we all have the same goal of making sure, the minimal amount of, if you will, casualties from this, people getting ill and or dying. I don't know that anybody disagrees with it, not even the business sector. I don't think they're looking to put people in harm's way.
Yeah, and I think, I really like the tone of your response, Mark. I think those who are erring on the side of public health aren't trying to purposely kill our economy. Those who are erring on the side of reopening our economy aren't trying to kill people. everyone or most everyone in this debate is coming from a good place, and I appreciate your take on that.
And
So,
Sandy, on that point, you're 100% right, and that's the unfortunate reality. What you just said is exactly right, and you put it well. Because unfortunately, when people do have this dialogue and this conversation, because you're talking favorable about opening up, they're eliminating the fact that you're saying do it in a cautious way. People that don't want to go shouldn't go. So it's not that you're taking an extremist position on one end of this or the other. You said it right. Everybody needs to realize, businesses aren't trying to harm people, and I don't think that is their intent at all. And I don't think the governor is trying to kill business. I don't think that's the intent here whatsoever. It's just a very delicate issue to try to figure out how do we balance it and get things to some semblance of normalcy if we can, but yet allow people's comfort levels to play into that as well if they want to attend or even if they want to open.
Yeah, I always remind people that I talk to is that, listen, there's no good answer here, right? I mean, there just is no good answer that's going to satisfy everything. Let's talk a little bit more about this. So with what would you suggest then? Are you kind of advocating to the governor that counties be allowed to have a little bit more discretion within the general stay-at-home order, or are you advocating for the governor to change her approach a little bit?
No, I think I'm advocating for more information. Other than that color-coded chart, that doesn't really give us a lot of direction as to what is going to help her make that decision. Is she making it based upon feeling? Is she making it based upon, statistics? So if I know that, then I guess I can make a determination. Is it based upon the number of tests that have to be given? Is it based upon we're going to wait till there's a vaccine? What is it? And if that's what we're waiting for, to open all these up until we have a vaccine, well, I don't know that anybody would really agree with that, except those that are extremists and feeling like, there's a extreme fear factor they may have. I don't think that's possible. I mean, the economy will just be completely annihilated or obliterated if we're not going to allow this to happen, waiting upon a vaccine. So, I guess it's not that I'm trying to dictate how this should go. It's more of a how do I gather information more, I guess, refined that I can help. Whether it's a hair salon here in Macomb County, somebody who's want to open up a gym or their restaurant. I don't know what to tell them. I don't have a date. I can't explain it to them. I'll use an example. Our ballpark here, our minor league ballpark stadium that we have, Jimmy John Stadium. Andy Appleby has a great, 15-page plan on how he's going to do it, minimizing the number of people come in. But he just wants to know, when am I going to be able to do this? Is there a date? But I think he kind of falls into the category of that sixth phase, which says, unless there's some kind of a vaccine, large gatherings and facilities like that aren't going to happen. But I don't know that. I can't answer the question. And so he's even concerned about, I need somebody to tell me, am I going to be able to open this year or not? And there is no telltale sign to kind of help him with that. So it's more of I'm looking for information to help, some of the business sector as well as the public. But I'm going to repeat myself again. This has nothing to do with people that have, the fear. They can continue doing what they're doing, even if these businesses are allowed to open. They don't have to go. They don't have to patronize, these facilities. Go get your haircut. You don't want to go? Don't go. But allow that business person and trust that they're going to put those, I guess, if you will, precautionary ways in place so that people that do want to go feel safe. And eventually, if people start to see that, it's working, they're feeling safe, let's deal with it. And the other concern is people say we worry about the second wave. Well, let's look at the first wave. We did the right things to minimize that. But in the process of doing that, we put things in place we didn't have before. The TCF facility, the Novi Center, getting PPEs available for our hospital workers. People now are better prepared to handle this if it happens again, whether it's this second wave or another pandemic. We were caught off guard, and that's unfortunate. We could sit there and finger point all we want, but the reality is I think we're better prepared as a result of this particular crisis to handle not only the second wave, but something like and similar that may come down the road years to come. So if there is a second wave, even by opening some of these things up, giving those businesses a chance to do what it is we trust that they can do or would do, if we start to see it, progressing in that upward direction again, you pull back and start shutting them down, and that's okay. And we're going to be able to handle that second wave based upon the experience we've just had preparing ourselves for that first wave.
And Mark, you obviously have some major hospitals and hospital systems in the county, certainly including the Henry Ford Macomb campus. What are those health professionals and your own public health officials at the county telling you about being able to open up a little bit more safely?
Yeah, you get Henry Ford, Ascension, Macomb, Oakland. We've got here. We got McLaren. A little bit of a Beaumont piece here too, and even Children's Hospital. So Martha Teaberry, one of our own hospital systems that we have here for elderly and or vulnerable population. So all of those folks, along with our health department director, and I credit them for a lot of not only the efforts that they're putting into this. It's incredible what our health departments around the state are inundated with, but how they're handling it. And that's a lot of us are relying upon information, even the governor. And we're trying to make sure we're making the best decision on behalf of public health. And many of them are saying, early on, get those masks out, social distance, listen to CDC guidelines. They're going to help you. And, I think everybody kind of bought into that because they trusted the health professionals rather than politicians. And so with that being said, now they're at a point where they realize, you know what, you can come to their emergency room. They're concerned because there are people that are worried about coming to their hospitals that are having health issues. Symptoms of heart attacks or strokes, and they're worried because these people are saying, you know what, I'm not sure I should go. Maybe they're inundated because of this other, pandemic that's going on, and people have fallen ill, and some have died as a result of that. They're concerned, and they're saying, no, people, you can come in now. We're good. We've got bed space available. We can handle this, and we're able to handle it. And even elective surgeries are now are being scheduled. So they're saying it's okay to come back to the hospital. So basically, what we're hearing from them is they can handle us. They've done a great job. There are beds available, and credit to our health professionals, not only for the work they did with people that have had the discomfort of having to deal with this crisis, but still working through the other issues that we're seeing in society. And they would always caution and kind of lean more towards the fear factor. I always say I say that directly to our medical professionals here. Every time they come in, they got the masks and the gloves and everything, and I don't discount that. There's more of a concern they always have because I guess of their experience dealing with health crises.
Right. Mark, let's turn more to the economy right now. Macomb County is an economic engine, not just for the region, but for the entire state. You have the lion's share of our military assets, our aerospace assets. You're critical to the automotive supply chain. How are the businesses in general responding, and what have you as the county executive been able to do to help businesses sustain this challenging period?
Yeah, early on, I think everybody was, questioning where we're headed, and then once the executive orders came into play, and obviously only essential, shutting down non-essential, I think people bought into it, and they kind of, realized, okay, this is an issue, and so they were concerned about their employees themselves, as well as obviously people that were visiting their facilities, and it was interesting, kind of watching everybody step back, but still wanting to be a part of it, wanting to help. And you mentioned, you talk about our military, and we're known for the arsenal of democracy here in this area. And with that, people also realize because we're so innovative here in Southeast Michigan, we kind of also took on that tag of the arsenal of innovation. From concept to consumer, we can do it right here in Southeast Michigan, like nowhere else. You know that as well as I do. But now we're seeing many of them stepped up. Whether it was trying to figure out how to create, N95 masks, what we need to do to try to help people with gowns and, face shields they were working on, even General Motors, and their efforts in trying to, making sure that, the breathing machines that they were putting together for people. It was amazing what these companies were doing, and they were allowed to do that because it was obviously something we were looking for to help us. So they retooled their facilities, and all across, Southeast Michigan, in particular Macomb County, they became what I was watching and visited some of these facilities, the arsenal of health. It was amazing the work that these folks had done to try to figure out how to become part of the solution, even though they were shut down. And so that to me was very compelling to watch that happen in real time. And I think more of that play out as time goes on. But let's get back to the regular businesses. We've had to counsel over 1,200 businesses about where we're headed. We did have initial monies come to us from the MEDC and First State Bank, about $1 million came in. We had to try to figure out how do we help some of those small businesses in Macomb County, and we got that out. And now we're looking at funding that we got from the federal government under the CARES grant. It was substantial, $152.4 million we got from the federal government. So Wayne, Oakland, Macomb, as well as Kent County got a substantial amount of money because of the impact it had on our area. It's not all for business, but there's a lot of areas that we can pool that money. And we're going to be making an announcement next week about what we're going to be doing with that money. A substantial amount of that is going to be helping our small businesses here in Macomb County to try to help them deal with the challenge they had and to kind of get them set for moving forward. So our business partners here in Macomb County and our planning department, and you know those folks real well, Vicki Rad, John Paul Ray, and the team, they're incredible to work with. And so we've got a great working relationship with our business partners here in Macomb. And, we're just going to continue to figure out how to get them through this struggling or challenging time.
Before I turn it over to Brad Williams for questions from our audience, Mark, if you're a business in Macomb County and you need some assistance, can you tell them where to turn, where to go?
Yeah, MacombGov.org. We have all the information anybody needs, MacombGov.org, and there's a business resource link that they can click on and get all this information we're talking about. And then shortly, we're going to have information as to how they can obtain one of those grants with money that's going to be coming available as well. So MacombGov.org for anything COVID related, anything county related, but more specifically to your point, anything business related. So MacombGov.org, go to the business resource icon, and we'll help you through your challenges.
Great. Operator standing by, just like Brad Williams. Brad, the floor is yours.
Well, good morning. Thank you for being here. I've got a number of questions here in the chat room, but the first one I'll ask you is relevant. I know that your sheriff and your prosecutor are independently elected, but you're a former sheriff prior to being county executive, and so there's a question in here about the choices that law enforcement folks are making regarding the executive orders. We've seen maybe in more rural counties, sheriffs just determining that they're just choosing not to enforce the executive orders. What's your philosophy on that, and what advice have you given to, the prosecutor's office in Macomb County as well as the sheriff?
Yeah, I'll answer direct, but it's interesting if you have to kind of to play into this. It's almost as I look back on my time as being the sheriff, having to go to some kind of a store because somebody's not wearing a mask, or they're walking the wrong way down an aisle, or going to a golf course because somebody is in a golf cart. These are incredible I guess questions for law enforcement to have to deal with under executive order. Now, understand executive order isn't the same thing as what a law created by the legislature, signed into law by the governor. So a lot of law enforcement are questioning, okay, what's the extent of this? It is a law. I mean, the governor decided to create an executive order. It is law. And so what you're finding is most law enforcement are saying, you know what, I don't want to go out there and try to compel people to wear masks and go the right way down an aisle in a grocery store or whatever the other issues are. But unfortunately, there's so much tension within society is what people are saying. They're not wearing a mask. Get over here, make them wear a mask, and or get them out of my store because they're not allowed in my store. So I think what you're finding from most law enforcement agencies, and this is how they normally, I think, conduct themselves, it's not to try to figure out, how do you force people to comply, but getting voluntary compliance. My experience in law enforcement has always been voluntary compliance is the best way to get compliance. And how do you get them to understand it's a governor's order, it's a safety issue, the store owner doesn't want you in here if you're not wearing a mask. So I think most of the time we're able to kind of manage through that. The question is, what do you do when you have those extremes? Whether it's the barber who won't close, or the person who decides to spit on a store owner, or even a patron of that store. What does law enforcement do at that time? Well, obviously it's not because they're not wearing the mask at that point in time. It's another assault type issue, and they will respond. But for the most part, if it's continuous, repetitious, somebody's just violating executive orders, to be quite frank, I think what I would end up doing is turn that over to Health and Human Services Department of the state and or the state police. Obviously that's the people who work for the governor. And, the sheriffs don't work for the governor. They work for the people that they're elected to serve. They have the right to make that discretionary decision as to whether they want to or do not want to, I guess, enforce her executive orders. And rather than put themselves in some kind of litigious position, I think that's why some of them are saying, listen, I'll go to the extent of trying to get voluntary compliance. I will talk to people, we'll engage with them, try to get them to understand it. But at a point where they're just not doing it or they're not following that order, I think it's time for us to kind of lean on the state police to handle that particular incident or situation, and or their Health and Human Services Department at the state level, people that do work directly for the governor.
There's a question in here regarding some of the states. We've talked about this a little bit, but some states are allowing counties to make individual decisions about how and when they want to reopen. And the question is, the majority of the cases in our state have been in the metro region. We've seen some flare-ups in Kent County as well. What are your thoughts on giving counties more authority to determine when they're reopened or not?
Difficult. I think it's a difficult decision for the governor to do that. It would be obviously her decision to make. But if you're asking for input, I would probably lean towards saying, take a look at regions. Have conversation with their leadership, whether it's mayors, boards of commissions, and/or county executives, to make a determination. How do we want to handle this, as regional partners, if that's possible? But I still think it's something incumbent upon us to kind of look at as a state and to decide, how do we fairly, I guess, incorporate all these communities. I would probably lean towards the regional aspect of it rather than county by county. I don't think that's doable, and I think we shouldn't get ahead of ourselves as a county. All we have done was follow CDC guidelines throughout this process, and any orders that have come down from the governor's office. We'll continue to do that. And again, I go back to the earlier conversation with Sandy. My only concern isn't that I don't support the governor, don't support her executive orders to stay home. It's understanding better how do we explain to the general public as well as businesses how we're going to start progressively moving towards allowing them, if they feel comfortable opening, what requirements it would take for them to be open, and then people still have the option of whether they want to go or don't want to go, and even a business can decide whether they want to open or not open. So I think that's the problem. We don't have that answer, and I don't know what we're basing it on, and I can't relay that to the public, and I get asked those questions every day, whether it's by email, phone call, in person, and I'm having a hard time just saying, I don't understand the color-coded chart, turn them over to that color-coded chart, or have them call the governor's office, because obviously they're not by order. And so with that I think has become the bigger challenge here right now. So I don't think it's county by county would make sense, but yeah, this region was hit hardest, and I think we would probably be the last to fully engage, when it comes to economic opportunities.
And have you put into place any different protocols or procedures for businesses to enforce? In Oakland County, pretty early on, they put in, health screening. I think in Wayne County as well. There's a question: is there any additional layers in Macomb County that businesses need to be aware of as we do start to reopen?
Yeah, and Brad, that's interesting. That was a question that was asked early on when there was some, I guess, orders that came out of the health department at Oakland County through the executive. Dave and I get along well, and we communicate. But as I looked at that, I'm thinking to myself, that health order is only as good as its enforcement. So the health order is basically enforcing, or I should say, putting into some kind of a law a recommendation from the CDC. And so those recommendations, CDC as well as the governor's office, we're complying with those, and we're allowing our business to comply with those. My challenge would be if all of a sudden I decide to put it as an emergency order on behalf of our health department, now I got to enforce it. And our health department isn't staffed to deal with that right now. Right now, our health departments across the state are inundated with trying to do this contact tracing. Anytime somebody has contact or somebody has tested positive, we're trying to figure out all the people that they contact with. I staff that right now with over 50 people to try to figure out how we're doing contact tracing. It's not possible for them to go to every business or every restaurant. And if I did that through my health department, that would be the responsibility of my health department to enforce that, not the sheriff or local law enforcement. That would be a health department directive under what's kind of considered an imminent danger order. So we have not done that. We're going to continue to advise everyone to follow guidelines of CDC, as well as any orders coming from the governor's office.
The last question I have for you, and I'll turn it back to Sandy because I know we're coming up on our time. You've mentioned, as businesses reopen and giving people the choice whether or not they want to patronize those businesses. What are your thoughts on the employees of those businesses? When their supervisors or their employers decide to reopen, their comfort level as to going back to work. Have you heard from your constituents about their own comfort level about going back to work? Particularly as manufacturing and construction reopening now as well.
Yeah, and that's going to have to be an employer-employee relation conversation. So if they realize a lot of their employees don't feel comfortable, they don't want to come back to work, they're going to have to make those decisions, and I guess they're not going to be able to open. So far be it for me to dictate that, to number one, say, well, then if the employees don't feel comfortable, you can't open, or vice versa. If the employer wants to open, then the employees have to show up to work. That's not for me to tell, but I think at some point in time, we're going to get there. At some point in time, we're going to get there where some of these businesses are going to be allowed to be open by the state. And the question becomes, are there still going to be these directives that are going to be put in place that you must wear masks, social distancing, put up the plexiglass, and whatever requirements are there, testing for, temperatures or whatever it might be. At some point in time, when they do open, they're going to be forced to do that, or that's going to be part of the compliance for opening. The question is, they could do that today, or it could be a month from now, 3 months from now. What is holding that back? What is making that? What are they predicating that decision as to when they're going to allow these businesses to do that under those constraints or those conditions? What is it that's making it, instead of 3 months from now, why couldn't we do that today? And that's the problem I'm having. I don't understand what the numbers, the data, the figures it is that we're looking for to make us, help the governor make that decision. That's the challenge I'm having right now.
Okay. Thanks. Thank you. And Sandy, I will give it back to you.
Great. Brad, thanks so much. Mark, just one final question before we let you get on with your day. You have a great economic development department. What do you and your team see are going to be the economic development opportunities coming out of this crisis?
Yeah, that's a great question, and we're always looking at that. With every crisis, there is potential for opportunity, and I've always thought that. My background in law enforcement, when there's a crisis, I'm in crisis mode, and I engage. But I always tell people, we're going to get through this. We got to get through this. We're going to get through this shit together, and it's going to make us stronger in some regard. And I believe, with that being said, economic development is going to be stronger. There are going to be many other opportunities out there. Many of them we don't even know. We don't even see what's happening. I was just looking online the other day because we've got some folks that are trying to figure out, how do we open right now, and can you get us the PPEs? Dentists in particular saying, we want you to give us these PPEs. And so we're thinking, okay, how do we provide that as a private sector? What do we need to do? Also, we go online, we look, and there's a company right now that are putting together these packages for reopening for businesses, that'll provide the hand sanitizers, the gloves, and the PPE for companies when they open. Now they've got these box care packages, I guess, if you will, for companies. So in my head, I'm sitting there thinking, somebody's starting to be a little bit creative, and they're getting ready. They're trying to get ahead of this, and they're trying to, financially, make a windfall as a result of it. But people are thinking they're going to continue. So I think what we're going to see is this arsenal of help. I think that really has helped us with this idea that, there's opportunities in there for manufacturing in the healthcare industry, not only for the current crisis, but to deal with issues moving forward.
Well, it really is impressive how nimbly our Michigan businesses pivoted to provide PPE and manufacture things that they never manufactured before, just to respond to the crisis.
Yeah, and if I can, Sandy, just give out one quick other shout out with our educational component here. With our schools and Macomb Community College, all of them being closed down right now, the challenge was there. Early on, our school officials, Mike DeVault, our ISD, I'll put that up against any other county in the entire state. Amazing work that they do. Day one, they realized we got to start figuring out how do we do the online educational component for these kids while they're at home. All the school districts and superintendents gathered together, had these conversations, and but one of the things that they talked about right at the beginning was, we got a problem. Many of these kids get fed through school. How do we get the food to these kids out in the communities? I get a little choked up about it. They jumped into this, head first. What they started doing is working with the bus drivers. Is not only did they find locations at their schools for these kids that needed that, support, if you will, at the communities at their schools, the bus drivers were taking them into the neighborhoods.
Wow.
For these kids.
That's amazing. That just shows, there are heroes everywhere in this crisis, and it's also a great reminder.
That amazed me. I was in even our Meals on Wheels program, the people that have stepped up to help out with our senior population. Food was a big issue. It was a big issue, and I don't think people saw that at first. It was a health thing, but there were folks here that got that from our Macomb Community Action schools that said, we got to figure out how to feed these kids, and the response has been absolutely incredible.
Yeah, my boss, Patty Poppy from Consumers Energy, is fond of saying, everybody can't do everything, but everybody can do something, and that's a great example.
Yep, right. I agree. So,
Mark, thank you so much for spending your valuable time with us today. Thank you for your ongoing public service, both in your previous position as sheriff of the county and now as the county executive. I appreciate all the things that we do together, and best to you and Tracy, and we'll talk to you soon.
Thanks a lot, Sandy. Thank you.
Right.
Appreciate all you do.
All right, everyone, have a great day. Thanks again for joining us for the Tele-Town Hall. Stay safe, be well. Take care.